So when Lauren reached out and asked us to put together a panel around medicine, initially we looked and said, what does healthcare have to do with green? What does healthcare have to do with sustainability? And at the end of the day, it has a lot. The community can't continue to grow at the rate that it's been growing without a solid healthcare infrastructure. And those of you that have lived in town for as long as I have and longer realize we were the fastest growing city for 21 straight years. And unfortunately, our healthcare educational infrastructure was not built to handle that level of growth. So we had to import a lot of talent from out of market in. And we were able to do that in the nursing and the allied health areas, but when it comes down to attracting physicians to relocate to Las Vegas, we faced a bigger challenge. It's a little bit different of a dynamic, and really we needed to look at a grow your own type program, which is a sustainable model of workforce development. And when that came about, we had to look and talk about how do you produce new graduate doctors. And we had a couple medical schools here in town, but really it came down to physicians will stay where they do their last leg of training, which is known as a residency program or graduate medical education. And we were not very good at that. We had 3 existing programs. We had 15 acute care hospitals, and we had to grow that. So all of the schools came together and started collaborating and talked about how do we develop and how do we expand graduate medical education to get more doctors to train here for that final leg, and 67% of them on national average will stay where they do their residency. And so we all came together to work on that. So I'm going to ask the panel now to talk a little bit about that process and what the expansion of graduate medical education and what the expansion of academic medicine will do for Las Vegas. And Dr. Penn, you've been involved with graduate medical education's programs in the past back in Ohio. You were deeply involved in this process with the governor's office and the task force that was assembled. What will this do to change the landscape of healthcare in Las Vegas?
Well, I think there's several layers of this, and I just wanted to step back just one moment. As Mr. Geinzer was talking about after medical school, then we're talking about the residency or fellowship. Medical school is 4 years. We all have 4-year programs just so that we're all on the same page. And so medical students do that, but they can't practice medicine with an MD or a DO. They then have to do the residency training in order to get the certification in the specialty that they want in order to practice in that state, wherever it might be. So that particular time frame can be anywhere from a low of 3 years all the way up to sometimes up to 6 to 7 or so years, depending on how much more training that they need. So it's a long road. What I would share with you is when I came from Ohio here, I'll just give you one of the examples to build off of what's been said. We had 22 hospitals before I left that had family medicine residency training programs. And here in this state, we don't have that very many here that are doing family medicine. That's just one of the specialties that we talk about in medicine. But how this will change, I look at it 2 ways. One is it's going to be just really exciting for those of us that are in medicine, number one. The culture is going to change dramatically. And then that will translate, in my mind, to the next levels, which is going to be in the care that you would receive as a patient. So let me just give you just a little bit of a window what this looks like. When you're going through medical school, what you love to do is you love to have the next layer above you, the next level above you that you train with. So you want to have the residents around you. And so it's wonderful to be at UMC or one of the hospitals that's doing residency training as a medical student, because I can be there because that's what I want to be someday. So that's the first thing. The second is in that hospital setting or even in an outpatient setting, you have then an attending physician that is with them. And so you have a team of 3 that are there together in general. I'm talking about medical education only right now. But it's exciting for the students, the residents, as well as the attending physicians to have all the different minds at different levels, because we all bring different views. You know, many of us that have been in practice for many years, we need challenged. We need to do it better. You know, we need to know what the outcomes are that are relevant today compared to what they were 20 years ago. But that's one thing you will see, you will hear, but you probably won't experience if you're not into the healthcare like we are. But that's going to be one of the major things. That's the fun part of medicine. It's the challenging part, but it's something that the culture will change. The other thing that I would just quickly add, it's about then what that translates to. In my opinion, what that translates to is a better team, not only a team within medical education, but those working with the nurses and other practitioners that are around us, trying to figure out the best things for patient care. And we're challenging one another with what can we do better to help the patients that are in front of us. And I think that that's what you're going to see in the future. These specialties that we talked about, primary care, at the entry level for many of these things, we want high quality no matter what you're going into. And so we want these students to really succeed because we can really see as we work together as a team that healthcare outcome for the patients in front of us is going to be enhanced. And you'll see that.
I'm going to spend a little time so the audience really understands the importance of this expansion of graduate medical education and what that means from a quantitative as well as a qualitative standpoint. So prior to the governor funding this, we had 3 programs. If somebody could spend some time talking to us about what that $10 million did to expand GME, what it looks like today and what it may look like 3 years from now, and what does that do for the entire valley?
The governor's money was for seed money. It wasn't allowed to do anything for in perpetuity, but what it was to help hospitals that didn't have programs or hospitals that did have programs and wanted to expand them to actually add positions. So some of the money went for building facility, the offices for the residents, and hiring new faculty to help teach them. And I think money was given to Mountain View for their 300 additional residents being added. Money was given to the Valley system to help them start up their first residencies this summer, and ultimately they want to have about 300 residents in their program as well. Both of those are going to be mostly primary care. Money went to Reno, but it's coming to us this summer for a psychiatry expansion of about 6 more residents, I believe, in psychiatry, and something like 8 more residents in OBGYN, that expansion as well. And then money went to Reno, to Renown, to build programs there, and a geriatrics program in Elko, and a family medicine program, I think, jointly in Reno as well. So it really added a lot of spots, and those are spots that we hope will keep our own students in the state, as well as be able to draw students elsewhere. And I really want to commend the geriatrics fellowship. That's something that's a huge need in this community, and the more that we can add in geriatrics, the more is going to be necessary in the future to take care of all of us as we move on.
I think that's the challenge. We have one of the fastest growing states still after decades in the country, but it's growing twice as fast at the senior citizen level. And so, and geriatrics is not just primary care that happens to be for older individuals. It has to address a very complex set of medical conditions and try and understand and treat all of those. And so it does require quite a bit of training. And so we're happy we teamed up with several of the systems of skilled nursing facilities, as well as the VA, in getting fellowships going in all of those areas. So hopefully that will at least start an area that we all will see continue to have need in and grow in the future. I think the whole issue of residencies, the whole issue of the governor's money, is it's seed money. It gets the hospitals and the healthcare organizations over the hump. It costs about $100,000 per resident to get it started for all the training things that Barbara just mentioned. But once it's going, most of those programs are not only sustainable, but they actually generate additional revenues for the hospital systems. So it's getting that start that really is the challenge.
Mason, if you can take some time. First, I want to commend you on recently being recognized by the Nevada Taxpayers Association with the Cashman Good Government Award. That's big for UMC. You've done quite a big turnaround down there, so congratulations on that. But how can the community best partner with UMC?
You know, Doug, I mentioned early on, we've been serving the community for 86 years, and I know on the behalf of the 4,000 employees at UMC, we are very grateful for the community supporting the hometown hospital, and it really is all of our hospital. Again, we do a lot of outreach. One of our missions is to go out to the community. You asked earlier about How can we partner with the community? We have a division within UMC called the Healthy Living Institute, which goes out and does all kinds of classes. We do a daddy boot camp. We have Tai Chi classes. We have, how to install car seats properly. But one of the things that I like to reach out to the group, and you can call the hospital and say Mason said call, and we do employee health fairs where we do screenings and diagnostics. So be glad to offer that up to the group. And we've done about 150 just in 2016 of health fairs. Again, we send our doctors and nurses to help educate and about preventive and wellness. So again, just very appreciative of the community supporting UMC, and really, again, I firmly believe it is our hometown hospital.
Thank you.